Feeding a newborn is supposed to be instinctive, but for many families, it's unexpectedly hard. If you've ever wondered why feeding feels painful, inefficient, or exhausting despite doing everything right, oral ties may be part of the picture. Oral ties are common, often misunderstood, and highly individual. Some babies function beautifully without intervention, while others struggle in ways that affect feeding, growth, comfort, and long term development. Today, we'll walk through what oral ties are, how they can affect infants and families, what treatments and complementary therapies may look like, and how thoughtful, individualized care can support better outcomes for both babies and parents. Let's start with the basics. What are oral ties? A tongue tie, often called, now hopefully I don't get this wrong, ankyloglossia, and no, you don't need to remember how to spell that, happens when a short or thick band of tissue under the tongue limits how well the tongue can move. In newborns, that limited movement can turn feeding into a workout. We may see a shallow latch, prolonged feeds, or slow weight gain, none of which are on anyone's wish list during the newborn phase. If left untreated, oral ties can have longer-term effects, including speech articulation challenges, dental and oral health concerns like cavities, and inefficient or abnormal swallowing patterns. And it's not just the tongue. Lip ties and buccal ties, those cheek attachments, can also play a role and are often identified alongside tongue ties at birth. So while these ties may be small pieces of tissue, they can have a surprisingly big impact. So what does this look like in real life? First, feeding. Babies with oral ties often struggle to latch effectively, whether at the breast or at the bottle. You might hear a clicking sound during feeds, see milk leaking from the sides of their mouth, or notice feeds that take a long time but somehow still don't seem very productive. Let's talk about the nursing parent, because oral ties don't just affect the baby. Painful, cracked, or even bleeding nipples are common, and milk supply can swing in either direction, too low or sometimes too high. And when milk isn't moving well, that can increase the risk of mastitis, which no one asks for. Finally, growth. When feeding is inefficient, babies may not gain weight as expected. Over time, this can increase the risk of nutritional deficiencies, and in more serious cases, failure to thrive. In short, oral ties can turn feeding into a full-time job with very little payoff. When oral ties aren't addressed, their impact doesn't necessarily stop in infancy. It often just changes jobs as the child grows. Speech, swallowing, and chewing can all be affected. A restricted tongue may make it harder to articulate certain sounds or move food efficiently, which can turn everyday eating into more effort than it should be. From a dental and oral health standpoint, tongue tie has been associated with crowded teeth, malocclusion, gum recession, and a higher risk of cavities, despite excellent brushing and very determined parents. There are also airway and breathing considerations. Limited tongue mobility can influence the development of the hard palate and airway and may contribute to mouth breathing, disordered sleep, teeth grinding, night terrors, bedwetting, and in some cases, sleep apnea. And finally, oral ties don't exist in isolation. Tight fascia originating in the mouth can contribute to surrounding structural issues, including, hopefully I don't botch this one too, temporomandibular joint disorders, postural compensation, and musculoskeletal pain. I made it. It may even limit activities like playing wind instruments, because it turns out tongue mobility matters more than we give it credit for. In other words, a small restriction early on can have wide-ranging effects over time. As children grow, the effects of oral ties can continue to show up, especially around eating. Some children are labeled as picky eaters, but for many, it's not about preference, it's about function. Limited tongue mobility can make it difficult to manage certain textures, move food efficiently, or clean food from the mouth. When eating takes more effort than it should, avoidance makes sense. These challenges can affect meal times, nutrition, and overall feeding confidence for both the child and the family. What looks like stubbornness is often compensation. So, when we see ongoing feeding difficulties beyond infancy, it's worth considering whether oral function, not behavior, is part of the picture. Before we talk about treatment, there are a few important things to keep in mind. First, individual variation matters. Not every baby with an oral tie needs intervention. Some infants compensate beautifully and have no functional issues at all, while others benefit from treatments such as laser frenectomy or oral tie release. Second, professional assessment is key. Your midwife is trained to identify oral ties, evaluate how they're affecting function, and make recommendations for frenectomy or complementary therapies when appropriate. This isn't a one-size-fits-all decision. Third, while laser oral tie release is generally considered safe, it's not completely risk-free. Some babies may experience temporary feeding challenges in the first week after the procedure, and there is a small risk of bleeding. In other words, it's still a medical intervention, even when it's a minor one. And finally, timing matters. When a frenectomy is recommended, earlier intervention often leads to smoother feeding outcomes. Many newborns who have oral ties released within the first weeks of life do not require additional complementary therapies later on. The goal is thoughtful, individualized care, not treating every tie, but not ignoring functional problems either. Oral tie care doesn't exist in a vacuum. It works best as part of a team approach. We recommend lactation support for most families, regardless of whether a frenectomy is performed. Skilled lactation support helps optimize feeding mechanics, protect milk supply, and make feeding more comfortable for everyone involved. For some newborns, complementary therapies such as craniosacral therapy and chiropractic care can be helpful in addressing muscle tension, improving mobility, and supporting overall body alignment, especially when babies have been compensating for restricted movement. As children grow and even into adulthood, therapies like myofunctional therapy and physical therapy can support proper oral function, posture, and movement patterns. Think of these therapies as support staff, not the headline act, but often essential to getting the best long-term outcome. Here's what to expect during a laser oral tie release. At your tongue and lip tie appointment, the provider will perform a thorough evaluation of your baby's oral anatomy and clearly point out the areas recommended for release, so there are no surprises. Parents are welcome to stay in the procedure room for the entire process if they'd like. The only requirement is wearing safety glasses, because lasers and eyeballs do not mix. Before the release, the provider and an assistant make sure your baby is secure and comfortable on the table, and photographs are taken of the mouth both before and after the procedure for documentation. The laser release is then performed at each indicated site. Short breaks are given as needed for your baby's comfort, while still keeping the procedure efficient. Each release typically takes anywhere from a few seconds to a couple of minutes, depending on the severity of the restriction. Once the procedure is complete, parents are encouraged to feed their baby immediately. Feeding often provides comfort, reassurance, and a chance to start using that newly improved mobility right away. Aftercare is just as important as the procedure itself. This is where the long-term success really happens. First, daily stretches. Stretches at each release site are recommended 3 to 6 times per day. They're brief, they're purposeful, and yes, they are the least fun part of the process for everyone involved. Consistency here makes a big difference in healing and mobility, though. For pain management, infant Tylenol dosed according to your baby's weight or Hyland's nighttime teething tablets are recommended, starting right away and continued as needed for about 3 to 7 days. Comfort matters for baby and for parents. Follow-up appointments are built into the plan. The provider will see you at 1 week and again at 4 weeks after the procedure to assess healing, feeding progress, and to adjust aftercare recommendations as needed. Lactation support remains a key part of care. All newborns are encouraged to establish care with our lactation consultant within 1 week of the procedure to help optimize feeding with the baby's new range of motion. Finally, at-home bodywork. Beginning 1 week after the procedure, the provider recommends starting muscle stretches and releases at home using the provided handout. Additional referrals for craniosacral or chiropractic care may be made depending on your baby's individual needs. In short, this is a guided process, not a one and done event, and you're supported every step of the way. Oral ties are not an automatic problem, and they're not automatically something to ignore. What matters most is function. How a baby feeds, grows, and compensates tells us far more than anatomy alone. With careful assessment, timely intervention, when indicated, and appropriate follow up and support, many infants experience significant improvements in feeding and comfort. And when oral ties are addressed early, long term challenges may be reduced or avoided altogether. The goal is not to treat every tie, but to recognize when a tie is interfering a baby's with a baby's ability to thrive, and to respond with informed, collaborative, and compassionate care. Because feeding shouldn't be a struggle, and families deserve clear answers and real support. Thanks for watching.